It's essential for sickle cell patients attending hospital in severe crisis pain to be able to advocate for themselves. Unfortunately, the invisible pain of sickle cell is very poorly understood by most medical staff. And when this combines with the chaos of emergency departments and racial biases, it's very common for sickle cell pain to be neglected. I'm Dr. Lewis Thomas, a former medical doctor turned sickle cell coach, and I live with sickle cell myself. So this is the approach that I would take to self-advocate in hospital with a sickle cell crisis. So I'll break it down into 4 tips, but there's many more. So tip 1 is just be prepared. Attend the emergency department straight after taking your last dose of home analgesia, because it's better to assume that you'll have a long wait before you're able to receive anything stronger in the hospital. Also, if you've taken weaker pain relief like paracetamol or Tylenol, ibuprofen, codeine, tramadol, these won't be used as stalling tactics to avoid giving you stronger painkillers like morphine. So tip 2 is to always have a care plan. Take a printed copy of your care plan from your hematologist with you to the hospital, because it's better to be able to physically hand this over to the doctor as evidence rather than relying on them to look it up on the computer system, which is probably going to crash or be down or just not working for whatever reason. Tip 3 is to be aware of time blindness. So for medical staff, just a minute can easily turn into an hour or 2. If someone says they're going to do something, for example, get pain relief, ask them how long they're going to be and get a specific time from them. Then set a timer on your phone for that time, and if they haven't done it, ask again. And repeating this might annoy people, but it will get stuff done quicker. And staff who generally want to help aren't going to get annoyed. They're just going to be like, oh, thanks for reminding me, I forgot. Tip 4 is to know how to escalate. Sometimes you will encounter situations where adequate pain relief will be deliberately withheld on the pretext of whatever they decide. This is where having medical knowledge helps, but if you don't have medical knowledge and you suspect that something isn't right, here are your options. So you may be able to directly contact your specialist hematology team by phone to ask them to advocate for you. If you can't do that, you can speak to the senior or superior in charge, whether that's the nurse in charge, the consultant in charge, or the consultant on call at home that needs to be called in on the phone. And as a doctor, it makes me feel uncomfortable advising patients to do this, but this is one situation where it's completely justified to stand on business. And then the final thing is to politely and calmly ask for names of members of staff and inform them that you'll be making a formal complaint. And that's it. Those are just 4 tips, but it gives you an idea of how hard it is to get appropriate treatment as a sickle cell patient. Follow me for more sickle cell advocacy tips like this, because there's a lot more.